Hello, and welcome to our grief and loss training. This is for UC Santa Cruz 2022-2023. I am Groot, and before we get started, we'd like to make it clear on who will be in our units. So please take the time to find your name, and if you have any questions, please reach out to the Vol team. With that, I like to say a quote. Grief is like the ocean. It comes on waves ebbing and flowing. Sometimes the water is calm, and sometimes it is overwhelming. All we can do is learn to swim. Our number one responsibility when it comes to helping campers with grief and loss is to create an emotionally safe space. And today we'll be going over how we can achieve this. The psychological effects of losing a parent during formative years are significant. Children who experience parental loss are at a higher risk for many negative outcomes, such as depression, anxiety, somatic complaints, post-traumatic stress symptoms, shorter schooling, less academic success, lower self-esteem, and more sexual risk behaviors. When a camper experiences sadness, we instinctively want to help them move on from it. We may want to say things like, don't cry or don't be sad. The problem is that saying such things invalidates the child's feelings. During this healing process, we must provide emotional support, not emotional validation. Validating one's feelings is essential for children of all ages, but it is particularly important for children dealing with the pain of grief. This is something that we as counselors can do. It may come up in places like Cabin Chat or Empowerment, and our job is to be there, validate their feelings, and listen. The following graphic illustrates how each age group may interpret and understand grief and loss. Ages 6 through 9 may have fear and guilt behind the idea of death. Ages 10 through 12 may begin to ask practical questions regarding death and form a better understanding of it. And ages 13 through 18 may fully comprehend the fragility of life and begin to question many things such as their personal beliefs and practices, as well as fearing for the future. Keep in mind that there is no right way to process loss, and healing isn't a goal or a place to get to, but a journey. Our role as counselors is to help our campers along this journey and to remind them that they have a community ready to support them. Oftentimes, our counselors don't know what to say, and that's completely okay. And these are just some of the ways you can approach someone who has/had experienced a loss. So take a look and include at least 3 of these in your Google form response to this training. It's also important to know what not to say to a grieving child. Please take a little bit of your time to read through some of these. It's not only important for you to know what or what not to say, but also to make sure that our campers take accountability and are being respectful to one another, especially in a space where we will share our experiences. Grief is centered around loss, and while most of the time we automatically think death, there are things that all of our campers may be grieving, such as a loss of normalcy, such as a change in routine, parents not assuming the roles that they typically assume, and children having to step up. Their loss of childhood, feeling constant worry, doing more adult tasks, loss of connection, no one understands them anymore. And how might this show up day to day? They may experience feelings of loneliness and isolation, a desire to be alone, or an inability to converse with or reach out to friends and loved ones, loss of control of your thoughts and feeling like they're going crazy, difficulty concentrating, numbness, guilt, remorse or constant anxiety, fear, frustration, and anger. One of the best ways adults can help young grievers is to listen to their stories. Telling their story is a healing experience. After a death, many children want to share their story. Telling their story is a healing experience which we can offer through empowerment and cabin chat. And one of the best ways adults can help young grievers is to listen to their stories. Children also need continuity. In other words, normal activities such as the work we do outside of empowerment, like kickball, mealtime, or songs. The following is important to keep in mind when trying to help campers through their grief. that we cannot provide therapy or counseling. That is why our medical health professionals will be on site at camp, and we cannot tell them that everything will be all right or what we think of their prognosis. If someone is seeking help, talk to them, then find the mental health professional and camp advisor for advice. If someone says anything about hurting themselves or wanting to hurt others as well, find the mental health professional and camp advisor immediately. It is our job to listen, provide positive social support, and acknowledge what they understand about their parent regarding the situation. Providing positive social support means that we will give them space to feel those feelings and express them, not judge them, correct them, or otherwise interpret them. We will close off with an activity that we did during our training. It will take about 5 minutes, and I will ask you to close your eyes. Now, I want you to think about a time where you felt safe, loved, and happy. I will now ask the following questions to what you were thinking about. Were you with other people? Were you outside? Were you doing something you'd like to do? Were you having fun? I guarantee that you responded to at least one of these with a yes. By just being in camp, we are creating the right atmosphere for our campers and staff alike to create memories where they feel safe, loved, and happy. And this may be the best thing we can do to help with grief and loss. With that, that concludes our grief and loss training, and I hope you have a great rest of your day.